Welcome back. Now, we have talked about the amazing transformations that Tucson Mini Dental implants can do, but what really hits home is when you can kind of hear and see the expressions on the face of someone who has actually experienced it for themselves. Take a look.
Oh, it has been the greatest thing that I've ever had done teeth-wise. It really has. Oh, I can eat things that I never ate for several years. It feels solid in my mouth and just feels good overall.
It feels good. That was a patient of Dr. David Tambor, and as you can see, he is a happy camper. Let's find out how the doctor did that. Doctor, thanks so much for coming back.
Thanks, Tina. It's a pleasure.
Can I tell you that's my favorite when you come and you bring me videos of some of your patients, because it just warms my heart to see how happy they are. Who was that? Who was it that we were?
That's Pete, and he is a gentleman who's in his mid-80s, who is was suffering with dentures, just could not eat with them. And he had been, I guess he told me when he came in, it had been about 2 years and was really struggling, and his dentist just wasn't able to help him out. And we did that for him, and it was pretty quick, start to finish. We placed the implants, made the dentures for him within a few weeks, and he had his teeth, and he is just, you saw, it's very fun to watch him. It's very fun to see him because he was very excited.
Oh, I love that. I love that he said it's been years since he's been able to eat certain things, and that he's feeling, you know, how the teeth feel very secure, which is a word I kind of hear from the patients is kind of a common denominator. But when we're talking about mini dental implants, you have brought me the teeth before, and we've kind of showed the things that you do, but you brought me something new today. I said, what is this little thing that you brought?
This is a mini dental implant.
That's the actual implant.
Yes, and it's a little screw, and it's quite small. And actually, the reason it's called a mini as opposed to a conventional implant is because the diameter is very narrow. And the whole technique involved with it is a matter of placing a little tiny pilot hole in the gum, and these are self-threading, so we don't have to do surgery, we don't have to cut the gums. It goes right into the gum and into the bone, and then we're able to put teeth on it, give people back their teeth, whether it's a single crown, whether it's a bridge, or dentures. But that whole, like, I mean, you can eat an apple. You can eat corn on the cob, which blows people away, because anybody who's had dentures knows that you probably are having to use this goopy glue, and even with that, they come loose. So it's a tremendous procedure. This is an example of a full upper denture, but there's no palate. And most people who have something like this understand they gag from that palate. Yeah. No gagging. It's terrific. Press fit tight. We can even give people back their own teeth. So essentially, this has no plastic anywhere. This is like getting your own teeth back. And it's very, very strong. It's made out of zirconium. You put it on, patient doesn't take it off.
Yeah, when we hear that little click, that comes with that secure feeling.
Yeah, it's very tight. And they just come in once a year and we check them out and make sure everything's doing well. But it's terrific. And this is for everybody. I have a 19-year-old who was in a car accident a couple years ago, and he lost this tooth.
The front tooth.
And he came in and actually saw me on the blend.
Oh.
And we placed a mini implant for him, and 2 weeks later we put in the permanent crown, and he was blown away. Oh. You know, so it's 19 to 88.
Yeah.
I mean, and anything in between.
Because that's what we say, if you're missing just a tooth, like the 19-year-old that came in from an accident that happened, or you wear dentures and you want the full thing, there's so many reasons and people and ages and circumstances that this could help. The best thing to do is to come in and see if this is a good fit. Absolutely.
And we can tell you on that first appointment, I'll let you know, are you a good candidate? I'll let you know what the costs would be, total transparency. We'll let you know how long it's going to take. And there's no commitment. There's no charge for the consultation. You just come in, we'll do the scans, the x-rays, anything that's necessary. And I'll be honest with you. I'll let you know, are you a good candidate? Yeah. Can we do this for you?
And I think what I've gotten as feedback, like you said, some people saw you on the blend and they came in. The feedback that I got is that you have just such a great rapport with your patients and really make them feel comfortable. And I think that's why people continue to kind of spread the word about you. And that's a big thing when we're talking about our confidence and our teeth and how we're feeling, because it's more than teeth.
Oh, absolutely. You said it. It's about confidence. It's about being able to go out to eat and not have your teeth come loose at the table. Being able to eat what you want to eat, and feeling good about your smile.
Yep. And that's why I love these videos that you bring me of these wonderful patients. Doctor, I'm going to tell them how to get a hold of you because I know a lot of people are anxious for that. But thank you for coming back.
It's my pleasure, Tina.
All right. As a special for our viewers, call and mention the Morning Blend to receive 10% off any mini dental implant case. To schedule your appointment, give them a call now. They're at 520-298-6026. Or for more information, visit TucsonMiniDentalImplants.com.